The President. Address. Mr. Peter Shiu will address the Council on Public Accounts Committee Report number 82. Mr. Peter Shiu. Thank you, President. On behalf of the Public Accounts Committee, P.A.C, I hereby table P.A.C. Report number 82, which covers the 8 chapters in Report number 82 of the Director of Audit. I will briefly speak on 2 chapters on which public hearings were held. On Chapter 2, Emergency Dental Services and Elderly Dental Care Support, the committee notes that government dental clinics are established for fulfilling the civil service terms of appointment to provide dental benefits for civil servants and their dependents. Since 1947, the government has been using around 2% of the service capacity of the dental clinics to provide free emergency dental services to the general public. Due to the epidemic and the shortage of dentists, the dental clinics are already operating at full capacity. The quotas for emergency dental services decreased from about 40,000 in 2018 to 2019 to about 20,000 in 2022 to 23. To avoid making patients queue overnight for this as a result of inadequate service capacity, the Department of Health, DH, implemented the preliminary registration arrangement in September 2022. DH commences registering patients' information at 0 a.m. of the day of the general public GP session, and the registered patients can then return to the clinic in the morning for obtaining a list to receive service. However, the arrangement failed to address the issue of long waiting time for the public. The committee expresses grave concern and dissatisfaction about the undesirable situation. The committee strongly recommends that the administration should review the current mode of provision of emergency dental services and explore the possibility of setting eligibility criteria, example income level, for patients to ensure the proper use of resources. The committee welcomes the collaboration of the administration with non-government organizations, NGOs, to provide emergency dental services under a new service model to the underprivileged groups with financial difficulties starting from next year. The quota will be gradually increased to 60,000. On improving the queuing arrangement, DH will introduce an online electronic distribution and registration system this year. Furthermore, DH has changed the preliminary registration time in June from 0 a.m. on the day of service to 8 p.m. the day before. After completing preliminary registration, patients need only return to the clinic half an hour before their research sessions to receive service. On a related matter, the Legislative Council has passed the Dentist Registration Amendment Bill 2024, which seeks to relieve the manpower shortage in dental care services in Hong Kong. On elderly dental care support, the committee expresses concern that the achievement rate of NGOs participating in the outreach dental care program for the elderly varies rather substantially. As for the Elderly Dental Assistance Program (EDAP) under the Community Care Fund, the actual numbers of beneficiaries were less than the numbers estimated for the service years 2018 to 19 to 2022 to 23. The committee strongly recommends that the administration should actively enhance communication with NGOs and the implementing agent of EDAP to make sure that every elderly person with needs will be provided with service. On Chapter 5, Provision and Monitoring of Rehab Bus Services, the committee notes that since 1980, the government has been providing rehab bus services to persons with disabilities, PWDs, who are unable to use public transport services by means of giving subvention to operators. In 2022 to 23, subvention amounting to $125 million was provided to the operators. With the development of barrier-free public transport and car-hailing service, PWDs are given more choices of transportation mode. They also enjoy the concessionary fare of $2 per trip when taking public transport. Meanwhile, most rehab bus services require advance booking or application submission. Some services have experienced low usage over the past few years. To enable PWDs to commute at any time and to ensure the proper use of public funds, P.A.C strongly recommends that the administration should conduct a comprehensive review on the policy of rehab bus services and examine whether there are other more effective and flexible means to provide service, such as providing vouchers or direct subsidy for PWDs to use wheelchair-accessible modes of transport. To monitor the service provided by operators, the Transport Department (TD) has signed Memoranda of Understanding (MOU) with the operators to set out the general principles and governing guidelines, but the MOUs are not legally binding. The committee expresses serious concern and disappointment about the arrangement. According to the audit report, the two operators failed to comply with the requirements stipulated in the MOU on various issues. The committee observes that one of the operators used subvented vehicles to provide service in other self-financing activities that it operates. The committee expresses serious concern and finds the situation unacceptable. Although the issue was resolved after TD took follow-up actions, the committee strongly urges that the administration should review the current regulation of rehab bus services. The administration should consider adopting a regulatory approach that is legally binding. Pending the new approach, TD should strengthen its monitoring of the operators to ensure the compliance with the MOU requirements and the enhancement of operational efficiency. To improve rehab bus services, boost utilization, and ensure the best use of public funds, the committee strongly urges that TD should review the operation of various types of rehab bus services with the two operators to consider, for instance, the wider adoption of the shared use arrangement, enhancement of existing routes, shortening of the waiting and advance booking time, setting of a limit on the maximum number of accompanying carriers, and imposition of sanctions on users who cancel bookings without a reasonable explanation. Lastly, I wish to express my appreciation for the contribution made by all members of the committee. I also wish to thank the witnesses who attended the public hearings and not least the Director of Audit and his colleagues for their cooperation and support. Thank you.
Questions. Question 1. Dr. Chow Man Kong. President, it is learned that the frequent occurrence of power supply incidents in recent years